Hi, welcome to 3B Scientific. My name is Wendy LaGrange. I am the Managing Director and Vice President for Walker, one of the 3B Scientific companies. Very excited to show you our booth here at IMSH 2026. Immersive Interactive is one of our companies. We're actually showcasing one of our incredible technologies, our hyper-realistic technologies, through Strategic Operations Medical. This is our open surgical simulator, otherwise known as our OS3. And Dr. Reginald Francios is going to show us a little bit about the OS3.
Yeah, so this is the OS3. This is a torso, which would stay at your sim center. You start with the skin on. The skins are repairable, and these are basically organ packages. This is the chest. This is the abdomen. You can put them in separately or together. This is a multi-channel pump, and the pump allows you to vascularize each organ or each injury separately. So what I'm going to do now is turn on the heart on pulsatile flow. And if you look in here, this is turned way down so I don't make a mess, but there's the heart pumping pulsatile. I have cut away the pericardium, which is intact when you get it, so it'll create a pericardial tamponade. Once you release the pericardium, you can repair the 2-centimeter laceration in the right ventricle. We did make the pericardium thick enough so that you can make pledgets to bolster the repair out of the pericardium, which is a legitimate austere surgical technique. So I'm going to turn the heart off. You also can do the same thing with the lung and cross-clamp the aorta, which is deep down inside there and very difficult to get at, which is real life and very difficult to see. So if you want to come around this way, I'll give you a little tour of all the injuries in the abdomen. So there is a very large stellate liver injury, which you can make bleed. And you see I'm pulling it up non-anatomically. We deliberately hid this deep down so that when it's bleeding, the resident or the student or whoever's being educated, they can't see it. They have to find it by palpation with their hand. You can also put a clamp on the hepatoduodenal ligament here to cut off the blood supply to the liver, which is called a Pringle maneuver. And then if you'll see, I cut the peritoneal reflections on the reflections on the colon in order to roll it medially, and that gives you good or better access to the spleen. The spleen has 2 vessels. I've already taken one and sutured it here. The other vessel is in here. You'd have to take that, and then there's nice soft tissue in between. And then you have these little tiny vessels up here, which exist in reality, called short gastrics, and those will back bleed off the stomach if you don't get them. And you can get deeper into the retroperitoneum. I've already opened Gerota's fascia here into the retroperitoneum, and that gives you the left kidney, which is shattered, which again you can make bleed. There is an artery, a vein, and ureter, which is buried here in the field, in the blood. And then there's a damaged, I don't know if you can see that. Let's see if we can get that. That's a damaged iliac. Can you hit that last button over there? The far blue one, yeah, that's the iliac. Hang on, I think it's iliac. It should be. There it goes. And it's turned way down. You can make it bleed torrentially. But that allows you to learn to get proximal control, and then you can use that to make a homemade shunt and shunt the iliac. There's also bowel injuries in here, so like gunshot wound sort of things. And if you cut it, you can see that it's got nice 2 layers. You can sew it in 1 layer, you can sew it in 2 layers, or you can use the stapler, and with the stapler you can use end-to-end, side-to-side, any normally known configuration. you can use. So if you take it from top to bottom with both packages and you have, I don't know, early level or mid-level students and residents, you can run a whole decent trauma course from top to bottom over about 4 hours. You can turn this off. We're going to flood the field. Yeah, so that's it. It's military uses it, residency programs, and the other thing that it has, which is really good feature, is there's a lot of anatomically correct stuff in here, which we don't need for the injuries that we have, like the clavicles in the chest up here are anatomically correct because as we have a list of things we want to put into it, we don't have to take this back and retrograde fit it. So once we have the subclavian vessels, you'll just be able to put them into this model. Same thing, the pelvis in here is anatomically correct, which is not necessary for the injuries we have. But in short order, you'll have a fractured pelvis, you'll be able to have a bladder injury, preperitoneal packing, put an X-fixator on the pelvis. So a lot of that stuff we have back at the lab, but what we realize is that we can't, if you come to us for training, then we can use all those things because that's our people just do that. If you're a big sim center and you teach ATLS, ACLS, robotics, laparoscopic surgery, blah, 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 it's only one thing they do. And so if they can't set it up in less than 45 minutes, then we don't want it to go out yet. So if we can't figure out the pack and play aspect so that they can have it ready to go in 45 minutes for when you bring in a proctor and a team of residents and some medical students, then we don't think it's ready to go public yet because they'll just get frustrated and angry with us. But those things are all being worked on simultaneously. And the other thing I like about taking this to universities and working with their proctors is they give me ideas about other stuff that they want built that they would use. And so we're constantly shuffling the list of what to work on next, based on the number of people that say, hey, how about this, how about that?
One of the main focuses here at 3B Scientific is that we're not just individual products, but we are an integrated technology company. And our focus is on making educators' lives better, easier, and creating better patient outcomes. So this technology can be converted. We're going to talk about this in just a few minutes. You can also see our reality technology. This is our iSimulate product, our monitoring technology with reality, and we're going to come over here and take a look at that a little bit more with Anthony.
All right, so the reality system gives you the ability to get a high fidelity level of training using anything you want as a patient. So live role players, low fidelity mannequins. We have our own integrated mannequins that I'll touch on a little bit, but it's all instructor-led training. It's tablet-based. So the two iPads communicate to one another over a common Wi-Fi source, which we actually have hooked in the back of the bag here. We could replicate just about any major monitor that's out there on the market. You have the ability to run through your own scenarios. You could pre-write them. We also have a community library where you could download a wide number of scenarios directly to your iPad and be able to run those scenarios and edit them as you see fit. So you could run those scenarios that you have written, or you can make manual adjustments with the system by using the dials and pushing send, and you can override whatever's happening on the monitor. The whole idea is wanting to be able to touch as many sensory elements as possible when you're training. So not only can we adjust the different rates and rhythms, we could also do some really neat things like share media. So we have a bunch of media that already lives within the software that you can use to share during your scenario. Quite simple to do. You select the image you want, you toggle the button, you push, and it'll push the image directly onto the monitor. The nice thing is, you're also able to cast this, so if you were in a large group or you were doing a presentation, you can airplay this to a projector or a TV or something like that. We have our second monitor set up here, mimicking the transport monitor. That way, if we wanted to replicate, maybe doing a transition from, bringing somebody in from the field into a hospital setting, we could have our bedside monitor that's replicating the same vitals, which is really nice. And then we have some other integrations that you could add. A couple that I'll show you here. We're just going to swipe here and we're going to scan. And we're going to connect our Atlas Junior. And we're also going to connect our SimConnect device. And once these devices are connected, we can start to get some real-time feedback on the screen. So because there's CPR built into the mannequin already, if we start doing compressions on the mannequin's chest, we can get that feedback in real time. Now, this table is not really ideal for doing CPR. It's a little bit high, but you can kind of get the idea that we can get that CPR in real time. And then we have an event log that's keeping track of what we're doing. So in the TMS system, our training management system, we could do our after action report, and it's going to show you the actual result of the CPR graphically and numerically, so you can measure performance and you could save it to go back over with the student. The other thing that we'd like to show is the ability to get real-time ventilatory feedback. So our SimConnect system, which I can kind of turn the bag here and show, this is our new setup here, which actually, so this is the Wi-Fi router. That's the closed network that the two tablets are connected to be able to run the simulation. It also gives us the ability, it tucks right into the existing bags as a retrofit, which is nice. So this broadcasts the Wi-Fi signals to connect. We also have the SimCap and the SimOxy lead sets that snap into place. And that gives you now the ability to start to get some real-time ventilatory feedback. So when we scanned and connected before, we got them all connected up here. When we start to do our ventilations, whether it's intubation or with a bag valve mask, as we're delivering these breaths, we can now see on the monitor that real-time feedback. And that device snaps into the back there, and then it snaps right onto your existing BVM, just in between the mask and the valve. And that gives you the ability to then see that on the screen.
Hi, my name's Jack. I work here with 3B Scientific in New Products and Innovation. So we have got our very exciting new products here. We have got an integration with eSono. Our ultrasound online learning platform is now integrated with reality. So we're able to do ultrasound scans with our wireless magnetically tracked probe, showing real scan data in response to probe movements, focusing on an eFast product that allows you to see 3 different levels of pathology real time in training and change these pathologies dynamically. On top of that, we've got our SIM occluder, which is this very exciting device that fits into your airway kit. Connects in and allows you to change the resistance of an airway on any mannequin or even without a mannequin using either an iOS or Android phone app or the Reality 360 system. So we've got 100 degrees of freedom here, and we can dial up timings up to 15 minutes on the app, allowing you to give really subtle changes over time, encouraging people to really understand the feeling of a resistant airway that changes over time, and allowing users to really embrace that subtle change and respond appropriately. Super effective, gives great resistance, Bluetooth connectivity and USB-C charging. It's our hit product of the season.
We're going to make our way over to our Aurora mannequin. This is our respiratory mannequin. Aurora combines Atlas and our Ingmar technologies. We've got Roger here who's going to talk a little bit more about that integrated technology.
Yeah, so one of the acquisitions last year for 3B was Ingmar, which is the leader in respiratory training technology. And this is a mannequin that they brought to market roughly a year ago for doing specific respiratory training. One of the beautiful things about this is it can actually be connected to a ventilator, right? And you can change all kinds of patient conditions and run it off of a ventilator. So we're doing really well with this in the respiratory therapy programs. We can change all the patient conditions. I know you can't see this on camera, but we're doing bagging here, some of the resistance, so we can go ahead and get certain resistance here, and then I can actually change that. And then you'll notice that the bagging is a little harder. So the same thing if we're actually connected to a real ventilator, right? And this is a great price point. Most mannequins of this nature are going to be in excess of $100,000. This is right around $30,000.
Another brand within the 3B Scientific portfolio is Walker, our simulated medication line. This is our ACLS PractiMed bundle. Walker has medications, simulated medications, vials, ampules, IV bags, code meds, oral meds, any type of medication that's delivered in a patient setting. We make a simulated version of it. One of our other companies is LifeCast. So you'll see 2 of our LifeCast mannequins. This is our Sharif mannequin, hyper realistic, truly amazing technology with regard to the realism of these mannequins. We're going to now make our way over here and meet Vishu, and Vishu is going to tell us a little bit more about one of our amazing technologies.
So today we are here with a virtual anatomy table. So in this table we have got like a total of 6 different software: human anatomy, embryology, animal anatomy, histopathology, atlas, radiology, and CT render. So here you can see that we have got like this human cadavers available. So we have a total of 6 different virtual cadavers available, and you can change the ethnicity of the cadavers here. So we have Caucasian, Asian, and Afro-American, and you can also change the gender here as well. Now there are like a lot of functions that you can perform here. So for example, like if you want to go every single layer of the human body, that can be done. Or let's say if you want to have the sagittal, coronal, and transverse view of the human body, that can also be seen from here. You can zoom in, zoom out if you want to rotate the body or move the body from one position to the other. Then there is another one reason why we call this like a virtual dissection table as well. So you can perform virtual dissection here. So here we have got 2 kinds of dissection available. One is a linear dissection, which means like you can make a cut in like one angle only. And this, you can see that this is like a linear dissection that you can perform. And you can see like this here. So in the same way, we have got like so many different functionalities available, which helps the professors to teach the students in a very interactive way. And at the same time, it helps the students as well to understand and see the things and learn the exact position or the location of the internal human organs as well. So thank you.
Going to make our way through the booth, taking a look here at our veterinary simulators. So another product within the 3B family is the VSI product line of veterinary simulators. We actually have our basic life support dog here. This is our canine simulator, hyper-realistic simulator for great veterinary training, as well as our feline. They've just launched our feline simulator. This is our feline simulator. One of the most exciting technologies that we have is our immersive interactive room. So we're going to make our way to our other immersive room, where throughout the conference we've actually had an escape room challenge for the attendees. It's been really fun. So utilizing the technology as well as kind of adding a gaming component to it. We had 3 task stations on medication administration and errors, as well as our cardionics heart auscultation mannequin, and then moving to our reality mannequin. So we gave our attendees a certain amount of time to come in and answer questions and do the escape room challenge. So here we're in our immersive escape room challenge, and I'm going to turn this over to Chris Porter, who's going to talk a little bit more about the immersive room.
Thank you. Yeah, so this is our immersive room. So it's a multi-sensory interactive experience. So the idea is we're projecting or creating images on the wall. We've got surround sound, and the students can interact with it. So step inside if you would. So this is what we've been running at the conference. This week we've got essentially an escape room challenge here. So the customers have got to come in, they've got to answer some questions, they've got to solve some problems in order to win an iPad. What we're doing different this year is we're connected to the physical props as well. So we've got a cardionics here, they've got to listen to some breath sounds, some simulated medicine from Walker, and they've got to read different items on here to solve the problems on the wall. And we've also got a reality iSimulate product. So incorporating the physical devices into the experience is really a big part of it as well. So you can see how they interact. They can just tap on the wall here. The questions will appear on the wall, and then they've got to utilize the items on the table in order to answer these questions. So it's been a lot of fun and a lot of interest in this particular type of activity. Escape rooms have become really popular in the immersive world at the moment because they allow you to teach a lot of different functionality. You can have team building exercises, teamwork, collaboration. It challenges your critical thinking skills, your decision making, leadership. So the escape room brings together a lot of different educational aspect, but in a fun and engaging way. So escape rooms are one of the most popular types of content we've got on the Immersive Studio platform. Right now, we've got about 12 different escape rooms. So I'm just going to switch over now to a different collection, and I'll show you some different content, if that's okay. 1 second. Dion, switch it over for me, please.
Yeah, and depending on the size of your room, your wall size will determine the amount of projectors. So basically, a 14 by 14, you're looking at 3 projectors. If you go bigger, like Miami Gaming did on that front wall, they're taking up 3 to 4 projectors.
Great. So we've been showcasing a lot of different content on here. So we've got a sort of selection from the huge library we have on Immersive Studio. So we've got different activities, we've got a whole escape room collection, and a lot of emergency services content. So we've got simulations, we've got cases, case studies, different applications from fire and rescue, emergency services, even some military activities. So let's take a look at some content on here. This is quite an interesting one. So we've got the capability to do drag and drop activities. So this is a little bit of fun. We've got PPE activity.
Welcome to the PPE challenge. Wearing the right PPE, check out the board for the infection you're treating, and drag the correct PPE to your nurse. You're up against the clock, so be quick. Good luck.
So we're just teaching about, correct use of PPE.
I was doing it in my room. They brought me in, and I started in the fall of 2013.
And we can just drag and drop that onto the nurse here. So that's quite an interesting activity. We can go back to the main menu. Let's have a look at some of the escape rooms.
Yeah, I did. I've seen. Yeah.
So we've got lots of different escape rooms on here. A lot of them are educational, teaching different types of medicine. We've got the Code Blue over here. Let's take a look at this desert escape room. So with the Immersive Studio platform, we've got a lot of these richly detailed environments. There's thousands of different experiences, thousands of different environments. We have 360 video, CGI environments, illustrated. But as I say, these escape rooms have become really, really popular. So we've got different challenges, different puzzles to solve. So the first thing we need to do is get into the base.
So I'm probably going to spend a week there if I can get away with it.
So we just enter the code here, de-scramble the code, and then we're into the challenge.
It's a relief to finally be out of the sun.
So with these escape rooms, as I say, you've got to use your critical thinking and problem-solving ability. So it's not immediately obvious what you have to do. You've got to search around. You've got to look for clues. So what we've got down here, so we've got a patient here.
Laceration running vertical down his right leg. We need to stop the bleeding as soon as
We build in all sorts of different clues, things like checklists.
red is for the laceration. The orange is for the burns. Blue is dehydration and heat stroke.
We've got a narrator as well, so it's going to be explaining what you have to do. We can also build in things like hints to help the students along. But these are really, really popular with the students at the moment.
So it looks like
Different clues they've got to find, there's different locks. And a lot of these puzzles will chain together, so you've got to solve one thing to then solve the next one to actually unlock the next phase of the escape room. So let me just try one more scene. Just tap on here. We'll go back to the main menu.
I didn't know if he was.
So let me just run through a very basic scenario. So So this is an in-hospital scenario, and I'll give you an example of how you can take, maybe like a classroom-based lesson and immersify it, turn into an immersive experience. So this is a cardiac arrest treatment scenario. So first of all, we present the student with different information. So there might be a patient history, a patient profile, fully anonymized, 12 leads for them to read. We can even bring in a vital sign monitor. And I should mention as well, this is also controllable from the tablet. So the facilitator is able to present information to the student on request via the tablet. We've got our handover information from our medic over here. We've got the ER physician, and we can also access available medicines and fluids that are available in this space. And we can tap on these to view videos, view more information, view details and things like that. So once we've assessed all the information and taken that on board, we can then get into the scenario. So this is going to now present a series of questions over the course of the case and how it progresses. We've got the patient monitor, the 12 lead, available at all times. And this is using a little bit of gamification to make it more engaging for the students. You'll notice at the top, we've got a progress bar. So the longer we take, the more the patient is deteriorating. So we're putting a little bit of pressure on the students. They've got to think, they've got to act fast in order to basically bring the patient to a ROSC. So as you can see, the questions can be quite tricky. We can have these multiple selection questions. So we can be quite challenging. You also, as the facilitator, you can create your own scenarios. So with the Immersive Studio platform, you're basically able to take any of these existing scenarios, customize them, adjust them to your local curriculum or to the level of your students, different ability groups. But you can also create your own from scratch as well. So I was explaining to a lot of customers over the last few days, you can take any 360 video, upload that into the system, add interaction points, touch points, add information overlays. You can bring in web pages, patient monitor, the quizzes, rich media, and you can link all these together in multi-scene scenarios. So, most of our customers around the world will create their own experiences as well. So this is something that customers always want to do. And the Immersive Studio platform gives them the ability to do that very successfully. Can I just show one more thing as well? To switch over to a different... Just plug this. Let's take a pause there. I want to show the scenario creator. I'm sure this will be of interest to Lance. Okay. So this is just on the front wall. So this is something we've been working on recently. It's due to be released later in the year. So this is our AI-powered scenario creation tool. The idea with this is going to make creating validated, high-quality scenarios much easier than it's ever been possible before. At the moment, it's quite tricky to find the right scenario, or it's time-consuming to create them using some of the tools out there. This will take minutes, or what would have taken hours previously, can now take minutes. So we've got a very simple process. The first thing we can do is upload a protocol. So these scenarios will be protocol aligned. We've got an agentic AI system behind the scenes that will read in the protocol information and draw out the relevant parts from the protocol guidelines and bring those into the scenario. And you're also able to upload your own. So it comes built in with AHA guidelines, European Resource Council and others. But you can also upload your own local guidelines, national guidelines and so on. I'm going to skip the protocol selection for now. And we can go through to the next section. So although this is AI powered, it still gives the human, the end user, the ability to fully control it and edit the scenario. So first of all, we can set the difficulty level, the duration. We can just dial that down a little bit. We can determine the scenario type, the language. We can output any language. And the key thing is we can build in these learning objectives. So if you want to say there's 3 or more specific learning objectives, you can build those into the scenario. We can input our own scenario concept, and so it can be basically anything you want it to be. Or if you're in a rush, you can just get some AI suggestions. So you've got some AI generated ideas, and we can then input those into the system. So for example, we've got maybe a wheezing situation here. We can then go to the next stage, and the AI will now generate some scenario concepts. So this is going to generate 3 high quality scenario outlines, which we can then choose from. So as I say, this is an agentic system where it's going to be validated as well. So the AI will have a medical validation step whereby it will essentially check the parameters and everything that's being outputted by the generation phase, and check that for medical validity. I'm just going to skip through because the generation currently takes around about 3 minutes. So I'm going to skip through to a previously generated scenario. So you can see all the details that we've been outputted here. So we've got, we've got our scenario metadata, we've got an overview, our learning objectives, which are very important, attended participants, required simulation tools. We've got the clinical handover using the SBAR communication protocol, very, very important. And of course, the debriefing points. So we're outputting some, debriefing points for the facilitator. We will be aligning that to the INACSL and ASPE and other particular simulation guidelines as well. So that's something we'll be making even more advanced in the future. You see, we've got our timeline, so you can view the different phases of the simulation, taking it right down to ROSC. And we can also preview the simulation. So we've got basically a graph of how all the different states connect to each other. You can see there's quite a linear simulation, a scenario, but you can also have branching scenarios as well. So this scenario flow graph will help determine how everything connects together. Just going to close that down. We can now export the scenario. So if we go to export, you can see we've got currently Reality and Immersive Studio. So you can take that scenario and import it directly into the iSimulate Reality platform. So, you can create as many scenarios there as you like. And also you can create a fully immersive experience. So this will use one of the agents, will select an appropriate background. It will generate a profile image for our patient, and that will then be brought into the Immersive Studio platform. So fully immersive experience from that as well. We've also got the document view as well, so you can export a PDF document. So all this is ready to go. You've got the scenario details and all the things we were looking at earlier. You've got the checklists, which are all interactable. Patient profile information, SBAR, our event timeline with associated checklists, scenario story, and where applicable, it will include the lab reports as well. So everything's available in this PDF format. You can share this with colleagues. So the system allows you to manage a tenant or an organization. So you can submit this for review by colleagues, share it with your colleagues via a shareable link. So they'll be able to access this on any device. So this is the scenario creator. This is something that's currently in development, but we expect to be adding much more features and capabilities to it over the coming few months. And we're going to be inviting some of our customers to get early access and to provide as much feedback in terms of what they'd like to see in the final version.
Thank you so much for joining us at 3B Scientific here at IMSH 2026. It's been a great conference for us, and we thank Healthy Simulation for your partnership, and have a great year.